cardiac murmur. Who am I to? Can you guess what is this? My pulse is usually regular. Usually regular. Rarely it can be irregular. Usual pattern is duck, 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 duck. Usual pattern is regular, but rarely it can be even duck, 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 duck. Rarely it can be irregular, but usual pattern is regular. Jugular venous pressure, no change, not elevated, no change in the waveform pattern. Jugular venous pressure is totally normal. Inspection, careful inspection of the brick body, no significant change. Palpation, forceful displace apex. When I palpate, what I can feel is forceful displace apex. Displace apex? What is the normal position for apex? Mid-clavicular line, 5th intercostal space. That is where your apex should lie. Apex now displace. It is not in the 5th intercostal space, mid-clavicular line. It is in the 6th intercostal space, mid-axillary line or anterior axillary line. It is displaced. Not only that, it is forceful. When you palpate your apex in mitral stenosis, what you can feel is tapping apex. Apex, just come and tap your hand. Here, forceful apex. Apex nature is forceful and displaced. Not only that, you can feel fluid thrill in the apex. If you palpate here, what you can feel is fluid going like this. You can feel fluid thrill. What is thrill? Thrill is a palpable murmur. Thrill is a palpable murmur. What you can palpate is forceful displaced apex, systolic thrill in the apex. Other than that, nothing. When you auscultate, what you can hear is pan-systolic murmur. Your normal heart sound is lub dub, lub dub. Now you develop pan-systolic murmur. You can't hear either lub sound or dub sound. What you can hear is pan-systolic murmur. No lub, no dub. What you can hear is so pan-systolic murmur is there. Best heard in the apex, radiating to the axilla. Increase with expiration. Increase with expiration. What is the murmur? 1, 2, 3, 4, 5. Your diagnosis is mitral regurgitation. Thank you for knowing it. What happened here is your mitral valve now become incompetent. So because of that, during the ventricular ejection, blood goes into the aorta, not only aorta, again back into the left atrium. During the left ventricular ejection, blood goes into the aorta. Not only aorta now, blood goes into the left atrium as well. Because of incompetent valve. Disease is mitral regurgitation. Cardinal feature is regular pulse, but rarely it can be regular. How it happened? Anyone? With the chronically overload left atrium, during the ejection, what happened? Blood going into the aorta, not only aorta, blood going to the left atrium as well. So what happened now? Left atrium overloaded. Because of that, left atrium start to enlarge. With that, what happened? Electrical current in the left atrium now can get disturbed. Your patient can develop atrial fibrillation. But it happens very rarely, not like in mitral stenosis. Mitral stenosis, here valve close, left atrium definitely has to enlarge. So what happened? Those patients most of the time can develop atrial fibrillation. Mitral stenosis patient most of the time can develop atrial fibrillation. But mitral regurgitation patient rarely can develop atrial fibrillation. Jugular venous pressure, inspection, no significant change. Palpation, forceful displace apex. What happened now? During left ventricular ejection, blood going to the left atrium and aorta both. For a while think 50% going to the aorta, 50% going to the left atrium. Now during relaxation, what happened? The blood which present in the left atrium also come. Blood which regurgitated into the left atrium also come. What happened? Left ventricle become volume overload. Left ventricle become volume overload. With that, apex deviate. Now your apex is deviated. Why? Left ventricle chronically develop volume overload. Left ventricle chronically develop volume overload. Now what happened? To displace that volume, to remove that volume, left ventricle has to generate more powerful force. If you remember your Frank-Starling law, if it is more stretched, it will more contract. That is the Frank-Starling law. What happened here now? It is more stretched. Now it has to more contract. Now apex become forceful. It is forcefully contract. So apex forceful and displace. If you keep your hand here, because of this turbulent blood flow, what you can feel is systolic thrill in the apex. That term you can feel. So next one, pansystolic murmur. During whole ejection, what happened? Blood regurgitating into the left atrium. So what you can hear is pansystolic murmur. During whole left ventricular contraction time, blood eject into the left atrium. That ejection produces sound. What you can hear is pansystolic murmur. Next one, best heard in the apex. During left ventricular contraction, blood eject into the left atrium. So this fluid column start to vibrate. That vibrating sound best heard. The closest position is apex. Left ventricular closest position in the chest cavity, chest wall is apex. So it is best heard in the apex. Not only that, this sound can transmit into the even axilla. So best heard in the apex, it can radiate into axilla. It is more pronounced during the expiration. As you all know, during the inspiration, what happens? You create negative pressure in your thoracic cavity. Then what happens? Venous blood rapidly comes because of the negative pressure in the chest cavity. Venous blood rapidly comes to the right side of the heart. So right side flow will increase. During inspiration, right sided murmur will increase. During expiration, what happens? Blood which is pooled in your lung now go into the left atrium. So left sided murmur will increase. During expiration, left sided murmur will increase. If somebody says this murmur increase with expiration, definitely this murmur should be in left atrium or left ventricle related murmur. This murmur will increase with inspiration. Definitely that murmur should belong to right side of the heart. Inspiration right side, expiration left side. That is all regarding the mitral regularization. Thank you very much.